Hello and welcome to Learning How to Give Glucagon. I am your teacher, Melissa Trout. The objective of our session today is by the end of the session, the participant should independently demonstrate glucagon administration in a situation environment, which is part of the psychomotor domain in the precision aspect. Our target audience is teachers in a K-12 school system in training to support a student with diabetes who is going on a field trip. Okay, let's begin. First, we should have already identified that we have a student who is in severe hypoglycemia. We've talked about this in other sessions, so we're going to recognize signs and symptoms. This would include being unconscious, having a seizure, or being unable to eat while having a low blood sugar or blood glucose. So we're going to delegate staff to call 911. Call 911. We are going to collect our emergency supplies. That's the glucagon kit, gloves if you have them, and ideally you would have clean hands when you're giving this. Okay. So first we're going to, if we can, we're going to wash our hands and put on gloves. I'm not going to do that today just for purposes of the demonstration. We're going to open up our glucagon kit. Okay, you can do that just by opening the lid here. All right, and we can see that we have two parts. We have our vial of a powder, that's the actual medicine, and we need to reconstitute it into a liquid form with our syringe that has some liquid in it. We can also see on the cover of the glucagon that we have our steps identified, and you can always refer to this if you need a few hints. Okay. All right, so first we're going to take the cap off of the glucagon powder, and we're going to hold this syringe in our hand. We're going to draw straight up to take the cap off the needle, and while we're going to inject the syringe into the vial, we're going to keep our hands away so that we don't accidentally poke ourselves in the fingers. We're going to gently push down on the plunger, injecting all the liquid into the vial. Okay, then we're going to swirl gently. I'm going to put the whole setup in my hand while keeping the needle straight and just swirl gently until the solution becomes a nice clear color. You shouldn't see that cake of powder at the bottom anymore. Okay. All right, now we will turn this upside down. We want to work with gravity. Okay, so I'm using one hand to hold the vial, and I am going to let the pressure make the plunger go down, and then I'm going to start pulling on the plunger until I get to the dose that is written on the box. So we're going to pull out the 1 milligram dose. Your student may have 0.5 milligram prescribed. You should know this before you mix up the solution. Okay. All right. We're going to take the needle out of the vial, and we are now ready for administration. Okay, I'm going to use an administration doll for this purpose, but for you out on the field trip, you are going to use the student's leg. We are injecting into muscle, and most students have well-developed muscles. Your nurse will tell you if you have a situation where you're going to give that shot in a different area. Okay, so we are going to be doing this in the leg, but I'm going to show you on this doll. This is an injection doll. I'm pretending that this is the leg. I am pretending that this is the side, the middle of the leg, out towards the side. First thing I'm going to do, and you can do this through clothing, is you're going to make a V with your hand, with your non-dominant hand, and give a nice press up. Okay, grab a nice big section of that leg muscle. And going straight down at a 90-degree angle, you're going to go well in the middle of that V so that you're not injecting yourself. Boom. Go all the way down. You're then going to move your thumb up to be able to push down on the plunger, injecting that whole solution into the leg, and draw straight up. Okay. To recap the needle, we're going to do the one-hand scoop technique. I'm going to take the needle, fish for the opening in that needle cap, and then I'm going to help by putting the cover back on. I'm going to put that back into the glucagon case, put my materials back in there. Okay, hand that to someone, write the time on that we just gave that on the box. And my student, I'm going to position on their side so that they do not accidentally aspirate while they're in recovery. Okay, I'm going to stay with this student until help arrives. Thank you, and I hope you've enjoyed learning how to give glucagon.